Open the meeting tonight, the Health and Human Services Committee meeting. As you can see from the agenda, Health and Human Services has 11 resolutions tonight. There are also 2 policies that will be going to government ops after they are discussed here tonight, because 2 of the departments covered in those policies are from this committee. At the end of the meeting, Rich and Shireen will be presenting, or Shireen and Rich can answer questions as well. We'll be presenting the Hipaa policy and the breach notification policy that will eventually go to government ops for passing. Also, before we get going in the meeting, Trish is on the line and she will briefly discuss some potential funding opportunities for our county, possibly some mobile home replacement program. It is quite time sensitive if we're going to pass a supporting resolution, and there are still questions to be answered, but she just wanted to give a little bit of background as they continue to research this grant opportunity. Trish, can you hear us?
Hi, Elaine. I can hear you. Can you hear me?
Oh, yep. So if I just did a little bit of the intro, if you wanted to briefly talk about this potential funding opportunity that could be impactful to the county around, I think it's home funding, then go ahead and do.
Yeah, great. Thanks. So sorry I can't be there in person, but I appreciate the opportunity to talk about a potential funding opportunity for the county. Wanted to bring it to your attention. It's the New York State Home Program. This is funding, federal funding that passes down through the state, and counties are eligible to apply as well as nonprofits. The application is due September 23rd, so it's a quick turnaround time, but an opportunity for partnership potentially came up in discussion around looking at another grant, the Community Development Block Grant for housing support a couple months ago. That's a different grant that's out there, but the program is also for housing, and home sites locally have experience running a mobile home replacement program in the county, which would be eligible for funding through this RFP. Up to $0.4 million is available for awardees, but the total amount of funding statewide is only $10 million, so there's not a big pot of funding. But Shireen and I have been having some conversations and keeping Dave and Elaine somewhat in the loop, having conversations about this potential opportunity with home headquarters to see what it would look like, and wanted to bring it up for discussion to see if there would be interest in applying as a county for this funding, if we can work through some questions between now and then. There definitely are a lot of questions about it. So, and I answer some questions tonight if there's specific ones. I do think a municipal resolution is required, which is why we wanted to specifically bring it through and have this conversation as early as possible, because there's not a lot of time to put together, and the next legislative meeting is actually after the deadline for this funding. So if there was interest and there was support, we would probably need to do an emergency resolution, is my understanding. But I'll just leave it there, and I'm sure there's some questions.
Heidi?
Hi, Tricia. This is Heidi. I wondered, because of the short time frame, how have you identified a grant writer to help with the writing? Yeah,
actually, the home site they would write the application with the support of their umbrella Station, home headquarters. Things we would need to do as well, and there's decisions we need to make about how and with the administration and things like that of the grant. But they have an administrative plan already in place for this program that they've been using for their home program that they currently run. So they would take the lead and do most of the lifting on that, I believe, Heidi.
So this is Elaine. I guess your feeling is that Home Site would go ahead on behalf of the county, because Shireen explained earlier today that they're putting a grant in for this particular project too. They've done the needs assessment and there appears to be countywide need. So if their interest was, they would get some funding for this. And if the county was eligible, the county could also apply for some funding. I guess they have identified the needs. I think Dave brought up a question. Is there any local match that the county, because writing the grant, if they're willing to actually do it, that's a huge lift. But is there a local match that the county would have to come up with? And, you know, if successful, how much work would it be to administer this grant?
Yeah, definitely. That's a great question. And just before the match, I just want to speak to the need a little bit with the program that's currently running in Cayuga County. This is the second round that Home Site is administering of that. They've got five actively in the pipeline that they're working on, and they've got so much need. They did a great job canvassing, but they've got at least another probably dozen, they think, that of potential qualifying homeowners for this program. So that's without even digging into like a formal needs assessment, just through canvas for the needs. But with regard to the match, there is a 25% match on the home program. I believe we're looking into it. So obviously, if that was a monetary match, that would be a different conversation. But I think the way the current program runs in Cayuga County with the home program is that they're using the value of the homeowner's land as the required match, because at the end of the day, the whole property is secured by a lien to make sure that the state's investment in affordable housing is maintained for 10 years is the time period. So I believe that is the way the match would work, but that's something we need to confirm, and that's one of those kind of go no go questions on this proposal moving forward. So that's the best answer I can give you right now on that.
And the people that potentially would be eligible would be individuals who are income eligible, who have a mobile home that needs rehabilitation, and that's what the money would be used for? Is that true?
Yeah, the money's actually, their program is mobile home replacement. So it would actually involve demolition. It could involve some site improvements, sometimes not necessarily in the best place. So there's relocation of homes, like if there's flooding on the site, there's site work that's done. So that's all included. And then there's the way they run the Cayuga County program is that they bid it out as a whole and really tried to work to get local contractors to take on the whole contract. There's a company they're working with now that's relocating to our county or to that right in Elbridge, right to our area that they're working with now. So they kind of bid out the jobs as a whole, and it's case by case in terms of what the site work requires and in order to get a unit on there.
And then, you know, again, obviously, I think you're correct in saying there are still some questions that have to be answered, you know, but if the county is interested in moving forward, they need a full legislative supported resolution that they're in support of applying for these funds, whether the county will get it or not. You also mentioned that, you know, the state would have to accept the experience of our partner agency, Homesite, as having the experience to do this, because I don't see the, you know, other than, like, as you said before, the county administering federal grants, we don't have a ton of experience in this type of project.
Right, yeah. So that is a question mark that we've got to, I have a call into the state on it to confirm it, what the response is and how they'll look at that. Home headquarters did seem to think they would consider that their experience, because they would be primarily doing the program delivery, but that is another kind of go, no go question mark of whether it makes sense to even pursue this. And then, you know, we've got to kind of work through some procurement questions as well. And
What do you see the time?
You know,
What do you see
contracting with partner agencies.
What do you see the time frame for getting those questions answered realistically, you and Shireen?
I think we would need to do it early next week, because home headquarters is going to need direction one way or the other, just because the application is due September 23rd. So if we can work through them next week, I think that would, you know, that would give them some confidence to either go forward or not. But I don't think we could go probably too much beyond that because of the time frame. And I guess the other thing I wanted to make sure we mentioned was that they are applying for funding for down payment and closing cost assistance under a different category under the home program. And they are going to include Cayuga County in their service area. They're going to service Onondaga, Erie, and Cayuga if we can support that through a letter of support. I think it would be great to support that, because there's not really a dedicated funding source right now for the county outside of the city of Auburn for that down payment closing cost assistance. So that's another thing we wanted to mention.
Go ahead, Dave.
Yeah, Trish, this is Dave. I got a question. If we have to have a 25% match, that's $300,000 that we would have to come up with. If we receive this grant, this county would have to come up with $300,000 to match that 25%. So I think the only problem, and I'm in total agreement with it. I mean, every trailer that's in this community could probably use an update and an upgrade. And I'm fully in favor of it. But again, to have an emergency resolution, which is what we would need because of the time frame, I would certainly want all the legislators' input for $300,000.
In addition, you
Yeah,
really
Dave.
do it with an emergency resolution, because you're going to be drawing from contingency that requires a 2/3 vote.
I agree. Yeah.
Well, Trish, Rich just said something I think you need to hear. Go ahead, Rich.
Yeah, I mean, if the county match is $300,000, that's going to be drawn from contingency, and that requires a 2/3 vote. You can't do it by emergency resolution. You'd have to have a meeting. You'd have to call a special board meeting, get everybody in the room, and vote on it.
I'm not suggesting that we do a cash match on this. I don't think we should do a cash match on this. If we were going to do a match, I would want it to be kind of the in-kind match that we talked about from the landowner contribution or the homeowner contribution. Wouldn't cost them anything out of pocket, but it would be the value of their land going toward that match. So I wouldn't suggest applying if we have to put up a cash match. That's a whole different discussion, I think, personally. Which we're, I mean, if you guys want to have that, that's your prerogative. But I would have a hard time with that. Because there's a lot of other housing needs. So $300,000 of cash could go a long way for a lot of different types of projects.
Another question, Trish, this is Rich. Is the resolution a requirement of the application?
Yeah.
It is.
That's what I've been told, Rich, but I still have to do a kind of a deeper dive into the RFP myself and check that out. I haven't seen the actual language on it. But Kerry Quaglia from Home Headquarters, who's the executive director, he did indicate that we needed that for at the time of application.
And honestly, Trish, as we talked about, just like with the CDBG county opportunity, if this becomes too onerous to try to get done by the current deadline, it is really something that we should keep on our radar for, subsequent years, just like we should on the CDBG money.
Definitely. And I would love to have a conversation about doing a countywide housing needs assessment and really getting our arms around the state of housing from a condition standpoint and an accessibility standpoint, affordability. We've got less issues. There's all kinds of stuff we could be looking at and cataloging and needs assessment that would really help us go after these funding opportunities and bring more money into the community to address our housing issues. Would also be a very valuable tool for our nonprofits to be able to access that data and information as they build their programs out for housing. So that's something that, if there was interest in looking at future program development, a needs assessment would be a great place to start to position us for going after those funds next year.
Yeah, Trish, I know we played phone tag for 2 days now. I'm sorry we couldn't talk today, but I just want to congratulate you. I think everybody else in here would too, that your enthusiasm towards these type projects is extraordinary. And I just want to give you credit for that.
Well, I appreciate you providing an opportunity to talk about it. I do think there's so much opportunity in our county for housing and affordable housing development. And this is kind of my passion with community development stuff. And I think we've got opportunities that we've been missing out on for a while now. And maybe we can get a stake in the ground with this or with the next one. But I appreciate your time tonight. And if there's any specific questions, let me know. Yeah, Eileen.
Yep. Okay. Thank you very much.
Thanks, Trish.
Thank you.
Thank you.
Great. Thanks. Bye-bye.
Bye.
Bye-bye.
Okay. Brenda, you don't have any resolutions, do you have? Oh, you do? Oh, I'm sorry. Oh, never mind then. Sorry. We'll start with the health department. Yes, you do the rate changes. Yes. No, go ahead. Come on. Yeah. All right. Yeah, there's only two, HH 10 and HH 11. And both of them are for the organization called Doing Business as Home Instead. And once again, they're asking for a rate increase because of the significant issues they have with getting staff to provide services. One for your respite program and one for ISEP, correct?
Right. There has been a change in the New York State regulations that those providing aid services now must be paid a minimum of $15.20 an hour. As of October 1st, this agency didn't think they were subject to that and found out that they are. So they've asked to increase the rates to cover the increased pay to the aides.
And they want to go up to $31
Yeah.
per hour.
Right.
Yep. And again, you're not flooded with aid service. So in terms of getting some of the needs met.
This is one of the several agencies we contract with, and we're just lucky whenever we can get an aid from any of them. Realistically, because they're so short-staffed.
If I could, I group together HH 10 and HH 11 and get a motion for those in a second. And then if there's any discussion, we can have one.
I'll move it.
Second.
All right. again, is there any discussion about moving those aid hourly rates in these two programs?
Only discussion I would have is what's the current pay?
I'm sorry,
20?
26 or 28?
28,
28.
went up $3 an hour.
And if you, without the rate increase, they would not continue to do business.
Correct, they would. And I think they really are paying minimum wage for at least starting aides at this point. So going up to 15, 20 an hour is about your $3. And of course, the long range goal here is to increase the availability of aides by gradually increasing the pay rate that aides receive. When they raise the rates for food service workers, it is now more lucrative to work for Dunkin' Donuts than it is to work for an aid agency and provide care to seniors. So we're trying to, the legislation is designed to increase pay to aides, and we're definitely going to see that. Whether someday we'll also have some increased funding go along. We've gotten a little bit with our unmet need money, but we're in that spot right now.
Any other questions on 18, 10 or 11?
Do you think because we can't find enough aides, it's gonna still stay within the budget?
So what happens for us is we have a pool of funding to use for aid service, and we contract with multiple agencies, and we monitor that budgeted amount and authorize service only up to the budgeted amount.
Okay.
Does that answer
Yes.
the question?
Any other questions? All in favor?
Aye.
Aye. Any opposed? Great. Have anything to add to your report, Brenda?
I really don't.
Okay.
Our annual enrollment for Medicare is starting October 15th. So we're already setting up appointments for that program. And that's where everybody who has Medicare has the opportunity to look at the upcoming changes to their particular coverage, decide whether it's going to really still work for them in 2023, or if they'd like to consider some other options, maybe better coverage, something more affordable. We have 3 insurance counselors that work with folks and are booked. They'll be booked with appointments from October 15th through mid-December. And we've already started setting up appointments. We're going to start doing the press releases and gearing up for that.
Thank you.
All right, thank you. Thanks.
Kathleen, you wanna, we can start with your resolutions, and I've looked them over. Maybe we could do the same thing, group together HH 1, 2, 3, and 4, and then get a motion in a second. And then if anyone has questions about them specifically, the first one is adjusting the hourly rate of the part-time peer counselors to 17 an hour. Obviously to attract.
And retain. So for instance, we had permission to fill a couple months ago. The individual who, we had 2 positions.
Yeah.
The individual who departed after a month, it really was because she couldn't afford to work and then still have people assist her with caring for her children.
Mm-hmm.
So this, we hope, will not only be attractive to retain interested people, or to attract them, but also to retain them. And it does fall under our WIC budget entirely.
Okay. And you're moving it from $15 or $12.50 or whatever it
Yes.
was?
Yeah, I don't have that in front of me. Sorry about
Yeah,
that.
I know it wasn't a whole lot.
No, right, correct.
HH2 is obviously good news, authorizing you $595,000 to participate in round 3 of the state septic system replacement fund.
So it's a little unique in this. This was one that was accepted by the legislature last month, but the language for the account numbers in the budget was not part of that. It kind of last minute. I think you might remember that day. It kind of came last minute when notification came through the chairman's office. So in that process, they just didn't have the account numbers, and we can't accept the money into the health department
Without
unless
the resolution. Okay.
I have a question. Can I ask it? Sure. This sounds great for someone in my neck of the woods. And you know that Saturday I will be talking to folks from Port Byron, Town Immense, and that area. Tell me in a few words or less what this looks like for the people who have to survive on septic systems, please.
it's not going to be real helpful for people unless they live around some of the lakes. And it's very specific to Owasco Lake, Cayuga Lake, Skaneateles Lake, and Lake Como. And you have to be within.
The larger lakes.
Yeah.
Okay.
And you have to be within a certain distance, your septic system of the water's edge. So it's very limited in who's eligible for this
What
particular program.
about the outlet, or I guess we call it the river now, right? The Wasco River.
Not
Doesn't
eligible,
matter.
unfortunately.
Okay, all right.
But I think it's worth, those are the things we can keep bringing back to ask, because a few years ago, Lake Como wasn't available. So they really, it's decided through DEC, the group that administers this, whether the water body is in poor condition. So they look at that too. So like when HAPS became an issue, that automatically took the Finger Lakes, made them eligible. And then Lake Como eventually also.
You would almost think that the rivers would be barriers.
They're connected.
Right. Okay, well, thank you.
If the rules and regs of the watershed pass, then some people will have to upgrade. And this is really for those individuals to help cover the cost for the upgrade.
This is a really great jump start that's good for them, because there's no guarantee when the watershed rules are passed, right, that we'll have this eligibility. And you'll see when we go through the statistical report, there's some language about how many people have been able to take advantage of this already, since we've had it since 2018.
Okay, and I'm sorry, one more question. Do they reach out to the DOH to?
Yes,
get
you can call the
details
health
about
department. Yeah,
Thank
and
you.
we've got information for them.
Authorizing HH3, authorizing the chair and the public health director to contract with the state for the bike pedestrian wheel sport safety program and accept just over $15,000 to support those efforts is HH3. And HH4 is authorizing the public health director to carry out a budget modification in the WIC program. And essentially, you've done this before this one time this year. You're moving unspent money from salaries into other eligible lines so that you're taking advantage of covering your costs for the WIC program.
Got it, correct. And I apologize to Amanda and Sheila because it came a few days later than typical. It needs to be done in September because that's when the grant ends at the end of September. And then their new federal funding starts October 1st.
We didn't even know it came late.
Yeah. Well, you guys didn't, but I
Yeah,
say
yeah.
it because I know we're all trying to be very conscientious.
Can I get a motion for HH 1, 2, 3, and 4?
Move it.
Okay,
Second.
all right. Lydia has some questions. She's already asked about HH 2. Does anyone have questions about any of those resolutions? All right, great. All in favor?
Hi.
Any opposed? All right, great. You talked
Got a
about your
few updates, just a few general updates, and then I'm just going to go through a few highlights on our statistical report that you would have only been emailed last night, but then I have hard copies here for. So to go back, our community health assessment is underway. That's a mandatory assessment that we do, that New York State Department of Health provides funding through state aid for us to work with our local hospitals in identifying and surveying the public ages 18 and older who are residents of the county, what they perceive and identify as some of their greatest health needs. It could be health system related, it could be public health related, it could be any number of things. So we work with an agency, RMS, who is helping us perform this survey currently. There's QR codes you'll see in some flyers around. We're going north and south, letting that be known. We're going into libraries and helping people fill things out. We're going to have a table out in front of the county building. We're really trying to get at least 1,000 responses is our goal. This information then is collated and used along with a handful, about 24 in-depth interviews to help us create our community health improvement plan for the next 3 years. And we know that all the data that comes through the assessment, yes, we'll make a plan as a health department. The hospital makes a plan as the hospital, and we work together cooperatively, but there are certainly going to be things that come up that we don't perform directly ourselves. And this assessment's really very helpful to a lot of agencies and entities within the community. So please encourage people to respond.
already did it.
On our, yeah, it's great. You'll see it on like Facebook and Instagram, but it's also on our website, the connection to that. We've been attending some school open houses and events in the county to talk about vaccination, lead poisoning prevention, and other public health programs. We've had it related to the bike and wheel sports safety. For instance, there have been some bike rodeos lately, Brogan Manor, Malone Village, Cato. There's been a few. Those are a lot of fun, and that's an injury prevention initiative. at the ones they had in the city, they used that funding. They were able to give away 60 bicycle helmets to children within the community. Hab analysis, you might have seen the media release that went out a few days ago. There were HABs identified, harmful algal blooms, within the raw water for the city of Auburn intake and the town of Wasco intake. Fortunately, it's low toxin levels. There's been nothing found in the drinking water, so finished water. That's something, fortunately, it hasn't been as common an issue thus far this year as in past years. Part of that may be due to the fact that it's drier weather and there's not as much runoff happening and the lakes don't churn up as much. But we're really moving into the time when we start to see it more frequently. So as part, it's keeping people aware, but also encouraging people for emergency preparedness to keep some clean drinking water on hand. And that's a gallon a person a day for that. COVID vaccination clinics continue. We will be sending out a release. Our next ones will be on the 21st and 24th of September. We're going to be offering all the vaccines to age 5 and up. So we're getting Novavax now, which is not the mRNA made one. It's more a traditional vaccine created, and the Pfizer Omicron bivalent one to address the Omicron variant. So that will be available for people. It will be walk-in. So it's I think it's a Wednesday and a Saturday.
Not Moderna, although.
Moderna is still going to be, yeah, Moderna, Pfizer, and Novavax will all be available.
And the Moderna one has the bivalent.
The Pfizer one has bivalent. Moderna, I don't think we have that available yet, but when it becomes available, we will be making use of it. I'll verify that, Elaine.
Okay, I'm just curious.
Elaine?
Oh, I'm sorry.
That's all, you can ignore me.
It's my friend.
Kathleen, real quick, is there new test kits coming out?
We don't have new test kits to my knowledge, but I think that's a great question. We have, we've been asking on the state calls whether they will be modified in some manner to identify COVID with the current ones that exist. We'll find out. What we're finding right now, and this is just anecdotal, people are reporting to us they may feel lousy on day 1 and test and be negative, and then test again on day 3 or 4 and be positive. So whether the virus, whether it's shedding, whether it needs to build up more, it's very curious, but it's more common than it appears that people are not initially testing positive when they're testing themselves. The PCR-based test should be more accurate.
I got word that there's some new ones in production, and I didn't know if you had received any.
I haven't
notification.
gotten word on that, but I'll follow up on that and see what I can learn.
But coming to the county, more access to COVID testing, or one that's sensitive to this?
Accessible. I don't know how they'll be distributed. I know there's a lot of them in production now, so I was just curious.
I'll see what I can find out.
Kathleen, getting
I'll find out about the Moderna and about the test kits. Monkeypox, we stay at the ready, and it's more educational based for us at this point in time. No diagnosed cases in our county. Polio, it's interesting. The New York State is releasing and will be shortly releasing some statistics on rates of polio vaccination for 2-year-olds. And they do that because with the recommended pediatric dosing, if you get it typically in the age groups recommended by the American Academy of Pediatrics, you should be fully vaccinated against polio by the time you're 2 years old. Local health departments have had the chance to view our data and ask questions of the state before it goes out. Cayuga County does very well. We have an 85% vaccination rate for 2-year-olds within Cayuga County. It is interesting, and when you see it published, it'll be good, because you'll see that there are some zip codes that they can't report on because the number of 2-year-olds are so few in those zip codes that it would not be statistically solid to share that information. So more to come on that. And then you all saw the statistical report. I'm going to hit a few highlights that I find have points of interest. We don't usually speak about our accounting and fiscal administration too much, but I put a little bit in here in the introduction. The last couple of years have been pretty significant. Usually, and it's pretty routinely, we administer about $1.5 million in grant funding. That's separate from the state funding and such that we do. And that helps to fund programs. The last few years, we've received more than $5 million in supplemental grant funding to address a lot of the education, vaccination, infrastructure support related to needs in public health and COVID-19 response. I flipped the page over to communicable disease. I think it's interesting to see how there have been increases. So 2020 and 2021, as I mentioned in the email, we just did not put out these statistical reports because just it's not a secret. We're working on COVID response. This was not a priority as this is an optional document we put together, but it really is helpful to see this, and it's helpful to see these years side by side. You know, we still have to do this work. So communicable disease response needs to be done regardless of what other emergencies may be happening. Campylobacter, I was really surprised to see that jump up. That's typically communicated through undercooked food or animals, unpasteurized milk. So while none of these were related to restaurant outbreaks, so these were people who actually were ill enough that they needed to get tested and sought healthcare and then were tested. So that's a big deal. Lyme disease increasing. You know, we see the mosquitoes, right? They're out there and they carry a lot of their vectors of disease. And hepatitis C, I think, jump on that. As sexually transmitted infections, I think we received from New York State Department of Health over the last few years that there have been some real outbreaks of gonorrhea and syphilis, which had not been happening in previous years. And Cayuga County is not immune to that. Thankfully, you know, these are treatable diseases. So when caught early can be stopped. Elaine, you brought up a really good question when you were looking through this about visits to our STD clinics. We have contracts with East Hill Family Medical, and we have a contract with Port Byron Health Center to help provide at no cost to the individual screening and treatment. We don't have a record of many people utilizing those services. There's two reasons for that. One, majority of people who are going to these clinics can make use of insurance. The insurance can be billed for these services, so we're not being billed. But the other is we couldn't get the records from them. They were just in flux themselves. So we'll see what happens this coming year and what kind of records we have. But we know that they are being utilized. Cancer Services Program, you'll see one of the big changes is we ceased administering that program during 2020, but we still provide services, which I think is of value to adults in our county. The Healthy Neighborhoods Program, we've spoken about that a few times. We had to cease making home visits and we had to wind up the previous grant cycle, but we've been renewed and we have different target areas. So we actually have just started getting some of the formal training this past month and we'll be in Port Byron, Metz, and Auburn very soon. You'll see people out there. Blood lead levels, again, we've talked about that quite a bit. New York State requires that we address any child with 5 micrograms per deciliter or higher. So that you'll see how that increased, right? When this regulation changed the number of people that we manage. Some of these children, when you look at number of children followed, like in 2020 and 2021, they may carry over from the previous year, right? So when you see the number of admission visits, those are new cases. So that helps to distinguish that a little bit. I think you'll be seeing a lot more visits now that we have primary prevention, when we really have the opportunity to go into people's homes upon their request anywhere in the county, particularly if they have children under 6 and under, but I think we'll go see for ages 8 and under, or if you say our daycare provider or a grandparent helps care for children for a certain number of hours a week, we will go in and we'll assess your home for potential lead risks. And so we can go and we can use our XRF zapper and say, yes, that windowsill does have lead paint in it. So you'll want to make sure that it stays in good repair.
At the person's request.
At the person's request. Yep. And there's no charge to them.
With regard to to me, I can't even believe that there are this many children in our area that have the blood lead level over 5 micrograms. Is there a region in our county that we're seeing this, or is it?
So there are children all over. It's been a little while since we've done a GIS map. I actually was going to talk with you and David. Next month is Lead Poisoning Prevention Awareness Month, and we'd really like to be able to do a presentation if possible to the legislature. So if that works out, we'll talk more about that. But we've had maps in the past that can show where our children live. Definitely there's neighborhood housing tracts that it's more prevalent, and it's our older housing neighborhoods where you see more of this. So prior to 1978 homes
Lead paint.
that have lead paint, that's the majority of our lead poisoning cases are through lead dust, lead chips, and paint. So there's very definitely certain areas within the city of Auburn, Fort Byron, Moravia, wherever, some of the older homes, and it may be well maintained, but depending how you do your renovation, for instance, it could cause a disturbance and children crawling around on the floor and then putting their hands in their mouth. It takes very, very little to cause lead poisoning, as you know. It astonished me too. I had really quite a lengthy conversation with our lead coordinator, and it's long-term impact. These children are just, it's really devastating at times. What can happen with children.
Thank you.
Women, infant, children, if there's a silver lining to having a pandemic, it's the fact that with our WIC clients, they could have virtual interactions for WIC services, and more people were more easily able to be served. So you see that in the numbers. It can be a challenge sometimes to have to bring your children with you to your appointment. So we were really pleased to see these numbers. It certainly kept things really busy in that office. And we're hoping, we don't know that this will occur, but we're really hoping that the opportunity for virtual visits, those are some federal decisions and state decisions that need to be made, but that seems to have been a really good thing for everyone. Children with special health care needs, page 8. Child Find is for children who maybe have been assessed. Their parents or families may have a question as to how well they're developing, but they don't really qualify for early intervention yet or preschool special education. So we just touch base with them every so often in the Child Find program. You'll see our referrals and children in active program for early intervention. Now, again, this is throughout the county. And then on the flip page for the children who are in preschool special education. So it gives you a sense of how things have been over the past few years and where there have been increases.
Sure. This seems to be trending in the wrong direction.
Yes. So we're hearing different things, right? So one, isolation, right? Children weren't out and interacting as much. They weren't in school maybe as much. They weren't getting, not only, they weren't perhaps going to the doctor's office as routinely as they might be. So that certainly has, I think, brought to light now that people are getting back into daycare, getting back into school age, or going to their pediatric offices, or going out. Like the Play Space is a really great partner that they will often talk with families, and they'll work and they'll do some developmental assessments as part of play, and can help parents make referrals to early intervention. So there's a lot of need in our community.
So maybe it's trending in the right direction because these issues may have been there all along, but we haven't been recognizing it.
We're hopeful that catching children, and it's very standardized. Again, I think all of you know, it's very standardized testing for who's eligible for the program.
Like 33% delay in one area. I mean, yes, very
Exactly.
prescribed.
It's done by, there's an evaluation team that assesses these children. So it's not discretionary. It's not subjective. Hopeful that we certainly see a number of children who improved with engagement and just they need a little boost. right? They need some help with occupational therapy or speech therapy, and often don't move from EI to preschool, or in preschool, they've flourished so well that they're not in need of special education services when they get to school.
You're right, early identification, so you don't find them when during kindergarten and you're like, oh, what the heck happened?
Right. It's real,
Yeah, no. it's true.
there's a lot of success stories. There's a lot of success stories. But yes, there's a lot of children who are engaged in these programs. Yeah, thank you. On to the environmental health side of things on page 10, food services down at the bottom. These are like the restaurants and the institutional food services. You know, a lot of sections still go on. And when you flip over to the top of page 11, we're into the food service that are like the mobile ones, the temporary food services. There's a lot, right? There's a lot of permitted entities. And we prioritize inspection based on those at highest risk. So the highest risk are food service providers who prepare things from scratch. Okay? So there's more opportunity that there could be some potential contamination. The medium risks are those, I call it like the prefab, but that's not the right term. The McDonald's where everything comes in frozen, and there you go. So you cook that, you do that. It's more prescripted how you make things. But it's always interesting to do that. And we make it a point to engage. And fortunately, what's really great too with the mobile and the temporary food service when they come into permit, even if you have an institution or restaurant. Prior to opening up, you're just inquiring, we have educational sessions and really talk about here's how you ought to operate to help prevent problems. The biggest problem, the most common one is food out of temperature. So either the cold food not cold enough or the hot food not hot enough. Moving further down on the page, children's camps. It was great talking, for our staff who've worked in environmental health for so long. So this has always been a priority because we want people who come and their children go to camp in Cayuga County to know that they're going to a very safe environment. And so they're the most complicated because they encompass all aspects of environmental health, right? There's the food service, there's public water potentially, there's the swimming waterfront things, there's, temporary residence. So it's quite a combination. So they take quite a bit of time to perform these inspections. And again, there's usually multiple inspections prior to opening, and then there's always at least one inspection during their camp operating time period. Septic systems. What I found interesting, the number of new, and number 7 on page 12, the number of new septic systems approved. That means they're new builds. That's new housing. So or it could be a restaurant, but it's a new building of some sort within our county. For those septic, not public sewage. 7A is the septic system grant program. So that will tell you since 2018, applications, submissions, approvals, and then actual follow through with the installation and the money then that is spent. So that's related to the resolution you just did earlier. ATUPA, the Adolescent Tobacco Use Prevention. We're seeing, I see it as unfortunate from a public health point of view. The number of tobacco vendors has increased. It's the vape shops. They're popping up more frequently. And the violations that we're seeing are related more toward, yes, you might sell to underage, but it's more the flavored vapes because it cannot be displayed and sold. Nuisance complaints, that's always kind of fascinating. Most of those tend to be garbage complaints. On page 3, there was one that, not graphic, but I'm going to be, it was animal carcasses that weren't properly covered. They were decomposing, and the smell was bothersome. So that that is allowable in the right, you just have to have the right work around them. And I learned a new word with that, hopeful. I don't know if you know that, but you look it up if you don't know it. It's interesting. Residential lead programs. This is tied into our lead poisoning prevention. So this is when we have our staff go out, our environmental health staff go out into someone's home and actually do the zapping. I call it checking the lead risks. And the enforcement actions would be related toward rental units where the property owner has not completed the required remediation within the allotted time period. Rabies, now, it's always a thing, right? And it often can be cyclical, but the positive specimens, it's back, it goes back and forth. It's about study. The people who receive post-exposure treatment, that's what PET stands for. The majority of those people are individuals who've awoken to a bat in their room and did not capture it, so that bat could not be tested. So you have to assume positive. A 10-day confinement is for animals that bite. So you have to watch them for 10 days to make sure they're not rabid. The 6-month quarantine is for animals who were bitten and you don't have the animal, the vector to test. And then we are required to provide 3 rabies vaccination clinics each calendar year. And we get funding through the state to perform that. I actually was kind of surprised because you heard of so many people getting dogs during COVID. I thought that there'd be more. And then what's new this year is I added some COVID data. We're putting together as part of the performance report, it's like a big statewide after action report, some data, and I thought it'd be of interest for people to have a sense of, time spent on this program, as well as, some clinics and that's an enforcement actions, et cetera. There's certainly a lot more collected, but when we finish this performance report, this I'll call it after action report, it is something we're going to try to consolidate for reflection, for historical purposes, for all sorts of reasons. And that is something that I'll share with all of you. So I know that was a lot of talk.
I have a question, Madam Chair.
Go ahead.
I don't know if this question is for you or Lauren. I think that it's important for us. I didn't know, Wally brought it to my attention about the overdose that we have in our county. It's like 30 or something a month, and from my talk to the chair, and he said it's actually gotten better, right? The deaths have decreased, but the number. Is there any way? I'd like to see those reports. I think those are important reports because I did not know it was, like, I assumed it was bad, but I didn't have no data behind it. Is there any way we could get? I know we get our COVID numbers on a regular basis. But if we can include that,
I think
nice.
It's readily available through Monica as the Healing Community Study Grant Manager. She has collected data for years. So yes, I think it would be interesting to look at, and it's certainly available, Brian.
All right, so should I shoot her an email, or is it something that?
Yeah, do you want, I can speak to her about it too,
Yeah,
if you want, Brian.
Yeah.
Yep.
I just like.
Have her reach out to you too.
Well, I reached out to Wally, so I don't know, I think they're in the same building.
They're in the
right?
same, yep.
So, but I kind of want, in my opinion, it should look like the COVID information that we get. It's kind of like in the same, I don't know, it's in a format rather than, I don't really want a big wordy one. I just kind of want the numbers.
I wonder if she could package it and just show the change over the course of the
Yeah.
years. Yes.
Yeah.
Every month, it'd be nice to get that information.
Okay.
Did you request that on behalf of the entire legislature?
Yeah, so I want to share it. I want us all to get it.
Okay.
She can send it out, right, to everybody.
And thanks, Brian.
Yeah.
I have a question, Elaine.
Yes.
This is critical information, and I appreciate having access to this. What do you expect your legislators to do with this, and what may be our priorities that we should be supporting?
I love that you asked that question. So it's primarily, it's, well, yes, that would certainly be part of it, right? But I think primarily it's a learning tool because it's really hard. We do so many things within the health department. This helps give, a picture of the variety of work that it gets accomplished, right? And it then helps translate into why we ask for the funds we do and have the personnel that we do within our department. There are times we use this for grant writing purposes for data. I think it's helpful, just like you're asking, where are we seeing more lead poisonings? It elicits questions. So then we can get you more information that might be of interest and benefit to your constituents, to you and your constituents, and we want to do that. Almost all of these things are things we have to do, right? There aren't a lot of reports out here on some of the optional things that we do. So this will be good, when we talk about that, when we want to attempt to do things that are optional. And I think it's worth sharing. It's not something we typically put out to the public, but we certainly could. I think it shows trends over time, and it's been very helpful for us. It actually started, it was probably 15 years ago, anyways, we started putting this together. And it's been really helpful to see, what's it like preschool special education numbers. Transportation costs are associated with that. That's related to a scarcity of bus drivers. It's helpful to see the places that children are going. It's not all to one preschool area, but there's, 6 different preschools outside the county and in the county that are utilized for special class integrated settings. And I think there's a great deal of information that when given the opportunity to digest it, you can pick the areas that interest you and then, talk about those and promote those and let us know where we might be able to direct our services better.
Anything else? Thank you.
Thanks.
Great job.
Yeah.
Thank you.
Thank you.
Christine, we have 2 resolutions here tonight. HH5 and HH6. Both are allowing the department to enter into contracts with county mental health.
Yes.
If you want to go through 5 and 6 and talk about the maybe possible amendments to 6.
So both of these are contracts that we currently have. These are renewals. First one is HH5. This would be allowing us to enter into the contract with mental health complete assessments on children that come to our attention, either through family court or that we're working with through preventive services. Sometimes the children are still living in their household with their family members. They might be placed in a respite type of situation with us because there was some sort of conflict or behavior concern with the child in the home, or the child has been detained by the family court judge. And the purpose of the assessment is really to have a qualified clinical professional take a look at what's happening with the child, the concerns the family has, the concerns that the service providers that are working with the child and the family are seeing, and have them complete some assessments that they think would be beneficial and do a summary report that really kind of brings everything together, the history, what's happening currently, and then giving us some recommendations, appropriate treatment levels. And that information is really useful to the judge in making some decisions on what to do in the case if the child needs to be placed. And also it gives good information for service providers around what to focus on, or maybe some other systems that we can look for services in, like OPWDD, things like that.
Yep.
So we're looking for a 3-year contract. And then HH6 is also a renewal contract. This is for children that are placed in a QRTP, and I've talked about this up here before. QRTPs are the qualified residential treatment programs that are residentially based programs for youth that are through OCFS. They're regulated by OCFS, and we're looking for the mental health to do these assessments that are required to be done on children that are placed there. There's the format that they need to follow. It's very prescribed by the state, and time frames that are prescribed by the state to really, it's like a check system, checks and balances to make sure that the children that are placed in residential treatment centers, QRTPs, should be there, that they meet that level of care need.
And these go to the courts.
Yeah, they go to the court.
They go
to the
judge
court.
has to look this over. And
Yep.
if the qualifying assessor says this child doesn't need to be maintained at this higher level of care, and that information.
Comes back through to us
And
and, yeah,
right.
right, and then we need to seek an alternate placement, try to find a lower level of care.
And if it does, then the placement is paid for. I mean, you're at risk if the child doesn't qualify and you don't move the child,
If
then
the-
you pay full shot for this.
If the QI, if the individual that does the assessment determines that this child really doesn't need this level of care, then you're right, that we would not be able to get the funding through 4E, which is very,
You're right.
very helpful to
Yep.
pay for these very expensive placements. So yeah, so we have had a number of children that have had these assessments completed. We haven't utilized the diagnostics too much anymore. We used to in the past, but we haven't had to do that very much, but they are useful sometimes. And so I'm asking for both of these to be considered contracts.
If we could get a motion and a second for HH 5 and 6, I'd like to offer up an amendment to HH 6, but after we get that motion,
I'll move it. Thank you, second.
okay? I spoke with Christine and Rich before the meeting, and if you look at HH 6, it's really authorizing the DSS commissioner to enter into a contract with county mental health for these assessments at a rate of $100 per unit of service up to a maximum of $2,500 per youth assessed. What I had questions about is in the last resolve, it looks like we're adding, the department has a desire to contract with mental health as well as other voluntaries who can serve. And my question was, well, at the same rate? So if we pass this, we're authorizing the contract with county mental health and whoever else comes forward at whatever rate. So we talked a little bit, it might be cleaner to just have this resolution be to contract with DSS, contracts with Cayuga County Mental Health, and just strike the language that says, as well as any other qualified voluntary agency who comes forward. Then we don't have to worry about what their rate of pay would be. If you have other qualified agencies, you'll bring another resolution
Yeah,
forward.
I'll have to bring another resolution because we do have a few other folks that we have contracts with. But you're right, to keep it clean with mental health at the $100 per hour per unit, up to $2,500. We have a couple other ones, and I will have to bring in something specific for each one of them and note those on the resolution.
And then, at the same time, Rich looked at the resolution and thought it might make more sense that the last resolve say that this period of contract should be from 10/1 of 22 through December 31st of 23, instead of starting in January. So I offer that amendment to HH 6.
Second.
All right. All in favor? Of the amendment? Okay. Any questions on HH 5 or 6?
We have to vote, yeah.
Yes. Okay. Can we get let's support for those two resolutions?
Second.
Okay, I probably didn't do it right.
You already did it.
Okay.
already on the
Yeah,
table.
All right, all in favor?
Aye.
All right, thank you. Do you have anything you wanna?
The only thing that I really wanted to say tonight is that we are very happy that we have been able to move staff into the space that actually Brenda's staff vacated in the basement. Once Brenda moved and got into her new space cross street, we got that area cleaned up, and we've moved our case integrity staff down there, and spacious for the amount of staff that we moved down. It's working out pretty nicely. That's going to give us an opportunity to move our attorneys down to the second floor where case integrity was. It will give them
Better access to.
better access to them, and just give them a little bit of they're very much in the hustle and bustle of up on the fourth floor in services. And I think that we think it'll work out better for them to have a little bit of space, and a little bit more ability to have some quiet time, get some stuff done, and not have people be so easily able to just kind of go in and talk to them all the time. I think it's good, and we like that the services staff have that kind of relationship with them, and that there is that ability to engage with them, quickly and often. But we think this is going to be a little bit better of a situation for us. And by moving the attorneys down to the second floor, it will give us the ability to move some other staff around on 4 that they're very overcrowded. So I think that this is a good thing, and I just wanted to say thank you for letting us
You're welcome.
take that
Very
over.
much. You need
I
it.
told the staff down there.
Definitely needed it.
No risk, you want your space back.
Glad they're happy with it. Thank you.
Did you want to say something?
I had a question, but Christine answered it. So
Oh, okay.
thank you.
Great. Thank you.
Great job. Thank you.
Okay, last but not least, Lauren, you have 3 resolutions tonight.
Oh, no, no.
We're going to group them together, yes. The first one is you're amending your state aid budget and by $4. All right, good, because it's got to be precise. Uh-huh. Okay. The second resolution, and I did send out everyone out a fiscal impact if they get so desired to want to see it. You're asking to abolish a typist position, which is a grade 3, and create and fill a senior clerk in its place, a grade 8. And typist is an older title.
Yeah, we're really looking to kind of standardize everyone in the same title that works, all of our intake and front office staff to have the same title. So we're trying to abolish the typist, which is an old title.
I mean, it will be more expensive years in the long run, but for this year, the typist was at a grade 4. The senior clerk will start at grade 1. I noticed the
Step
fringe,
1, you mean?
or step 1, the fringe benefits are much less than they were in this typist position, but we do have the fiscal impact of that. And at this point, it's going to be about a $2,445 savings for this year. But, it is moving a grade 3 to a grade 8, but as you said, more consistent with the functions they have to do. And then HH9, you have $100,000 that you want to contract with the Veterans Department for, so that they can provide peer supports to veterans.
So this was originally piloted in some other counties. It's called the Dwyer Funding. And now it's in the state budget. All counties will be receiving the $100,000, and it's really designated to peer services for veterans. So I've had a lot of conversations with Kevin, and it looks like that's something that he knows he can take over. So we're looking to contract with him to provide those services.
Yep. And what Rich told me is that there'll be a corresponding, some kind of corresponding resolution coming forward at his committee.
For the
Bringing
veterans,
another-
try to hire a person to
Be the
do
peer.
this.
Correct. Great, so this is now going to be across the state.
And it will be continued funding that will come year after year.
Okay, can we get a motion a second, then I'll get your questions, Dave?
Move it.
Second. Okay, any questions about one of those?
Yeah, I just wanted to congratulate Kevin and Lauren for working together for veterans. It makes it. We appreciate it very, very much. Thank you.
Okay, any other questions about those 3 resolutions?
No change to the budget, correct?
Just to accept and
I'll
to,
take the $4.
Oh,
that one was for $4.
That calculated across all the citizens.
Yeah, that's funny. I laughed. I'm like, oh, I'll vote $4. All right, all in favor of those resolutions?
Aye.
Any opposed? Great. Do you have anything?
The only thing I wanted to mention is, I know back in, I think it was before I even was in the position, but we accepted $66,000 from OMH for workforce retention funds. And I just wanted to say that we've sort of tried to be really creative in ways to use that money. So we are planning a staff retreat for like a self-care retreat for our staff. So I just wanted to let you all know that that's sort of what we've planned. I know we won't be spending the $66,000 on that, but a portion of it we'll be using for that. So I just wanted to kind of mention that here. If anybody has any questions, obviously we can ask. But that's money that we got through OMH for recruitment and retention, which we continue to have issues with. We still haven't been able to hire a social worker, really haven't had. I don't even know that we've had a handful of applicants at this point. It's been months that we've had the job posted. And that's still, we're waiting to fill that position for the mobile crisis program to be able to start. So try not to get frustrated about that, but hopefully we find someone soon so that we can start that program.
What criteria does somebody need to apply for a position like that?
A master's in social work or a master's in mental health counseling.
And
And they have to be licensed.
how much is the position for that?
I can't remember off the top of my head. It is,
60 something.
it's 60.
That's a lot. With a master's degree for $60,000.
Yeah, I don't know the total.
I think like by the time you get to step 4, it's close to 70, I believe.
And when we're
That's
trying to
social workers
encourage
live in
people to
on
take these jobs, it's not just the current salary. There's a lot of benefits to being a county employee. That's kind of the sell that we have to spin.
Yeah, I think that now there's a lot of telehealth agencies and people can work from home and they can make more than that, actually. They don't have the benefits of the county, but they get to work from home. So that's been sort of, we're up against that a little bit as well. So I don't know, hopefully we get somebody soon though. I'm trying to stay hopeful.
Heidi?
How successful are we with college internship or the required hours and keeping them on board?
So we've actually, I think maybe like every intern we've had has almost been hired as a full-time therapist there now. I think we've had, it's got to be like 6 or 7.
Good, right?
We do have 2 interns this year, and that doesn't help us in this moment, but hopefully in the future, some of those interns on. We always are trying to get students come and do internships with us. We usually have 2 to 3 a year, I would say. We try to keep them on. The only problem is there's a lapse, like once they finish their internship and if there's an open position, they have to be licensed. So they have to graduate and then wait to sit for their licensing exam before they can actually apply and go to civil service.
Remember, Ray was trying to do it, but civil service said without the license.
I already asked again.
Yeah, they can't meet the
Yeah.
minimum requirements.
Yeah. So that's all I wanted to say. Anybody have any?
That's a great
Thanks,
selling
Lauren.
point for interns in our county, that 100% of them become employees.
Almost, yeah. All of them that wanted to anyway.
Anything else for Lauren? All right, can I get a motion to adjourn?
Oh, you got
we got
a
the-
presentation.
Oh, I'm sorry. I'm so sorry. We
Why
have
would you
the,
forget about it?
and we hurry, and we have the PowerPoint too.
Yes, we do.
All right,
Forgot the Rich Graham show.
yeah, we get Rich and Shereen. Yeah.
Da-da-da-da-da-da.
Okay, as we said, this is courtesy coming here for discussion and going to government ops next, correct?
Sarah's helping me here. Yeah, I think there works. Well, hopefully, I won't keep you too long. Rich and I basically have worked on these policies together, trying to make them more understandable. And this presentation is just basically to summarize what you have already received to review and just maybe answer some questions and clarify a few things. But we just want to use, everybody received the policies for review. We're adopting, suggesting and adopting a policy for Hipaa, as well as amending the breach notification policy. Yeah. So with Hipaa, most of you are aware, or may not be aware, but Hipaa is the Health Insurance Portability and Accountability Act of 1996. Hipaa actually does the following, which is listed in the policy as well. It provides the ability to transfer and continue health insurance coverage for American workers and their families when they change or lose their jobs. It reduces healthcare fraud and abuse. It mandates industry-wide standards for healthcare information on electric billing and other processes. It also requires the protection and confidential handling of protected health information. The protected health information is known as PHI. Sorry, we get little glitches. So how does this relate to the county? The county is actually a covered entity of Hipaa. A covered entity is defined as a health plan, a healthcare clearinghouse. It's also a healthcare provider who transmits any health information in electronic form in connection with their transactions, and for which Health and Human Services has adopted standards. Therefore, because the county provides healthcare through some of its departments, it is a covered entity and therefore is required to have a Hipaa policy that covers the organization. The county is actually also a hybrid entity. And we say, well, what is a hybrid entity? A hybrid entity under Hipaa is actually a single legal entity that's a covered entity whose business activities include both covered and non-covered functions. And that designates certain units as healthcare components. The county has healthcare components and non-healthcare components within its organization. So back in 2019, the Hipaa policy and the amendment to the breach notification policy were tabled by the legislature, the Cayuga County Legislature. But unfortunately, COVID-19 happened. From there, myself and the county attorney, Rich Graham, we reviewed the previous work of the compliance committee at that time and the HIPAA-related procedures for each healthcare component. And we then identified the need for a countywide HIPAA policy. So let's start here. I've talked about healthcare components. So what are the county healthcare components? We have the public health department. We have mental health department. We have the sheriff's department jail facility, and we now have emergency management office. All other departments are considered the non-healthcare components. So it makes sense. So if departments have HIPAA procedures and policies, why does the county need a HIPAA related policy? And we've heard that question before. So as a covered entity that we actually went over, it is the county's responsibility under HIPAA to have policies in place to assure that the departments are meeting the minimum requirements to protect the privacy of patients' protected health information, the PHI. The county must also have procedures to notify patients in the event that there's a breach of their information. The amended breach notification policy provides clarity and coordination within the new HIPAA policy. So that's the reason behind the amendments of that policy. The county HIPAA policies will set a standard that ensures that a compliance officer is designated to coordinate activities of the HIPAA policy, privacy officers for each healthcare component. It will also ensure the federal regulation is followed and enforced with each healthcare component. It will also ensure that the county is in compliance of all requirements that fall within that regulation. And it will ensure that the proper training is provided initially and annually within each healthcare component. And it will ensure the standards of reporting of breach and documentation are followed and the records are maintained related to same as per the records retention requirement that is set forth in that HIPAA regulation. So who is suggested in the policy for the legislature to designate to be the compliance officer? That will be the Cayuga County Operations Officer. What is the rationale behind that? Well, the operations officer seems to be the logical point person whose job duties include assisting the chair with executing and enforcing resolutions, procedures, policies, and local laws adopted by you as the legislature. So who are identified as the healthcare components? HIPAA privacy officers. Well, those would be the employees designated by each healthcare component's department head.
Let me just ask one question.
Sure.
EMO got added. I must not have it
Yes.
most up to date.
Right.
And the rationale for adding EMO is someone that's billing, or I don't understand what's.
Because they receive, in the course of an emergency, if there's medical treatment to an individual in that emergency situations, they will on occasion receive reports pertaining to that individual and the treatment provided, that kind of thing, which constitutes a medical record that we have to secure.
This isn't EMS related. It's our emergency management office.
Yes.
Yeah, I guess.
I mean, it was an add-on at the suggestion of the director of VMO, because he said, no, we receive these records and obviously they follow HIPAA, but because of that, they would qualify as a healthcare component. So.
I mean, at some point DSS receives a ton of information on people, but they're just covered under the counties. You can't breach people's protecting health information. I did that.
All departments have to follow HIPAA.
Yes,
regardless.
yes, of course.
To designate them as a healthcare component.
Right.
Basically requires them to carry on a reporting function with the compliance officer. So there's a stream of information, so we know that.
Doesn't that
you know,
mandate them to give notice and do all these other things too? I mean, I would think it's onerous.
If you provide treatment to a patient, you have to provide them with notice of what you're going to do with their health information. Yes, that's true. And that's part of our policy.
Yeah, I guess I didn't picture in my mind them giving direct care to individuals on a regular
That
basis.
was our original theory, but according to the director, that was entirely accurate. So
I mean, if I'm,
caution, we included.
if I may add on to that for understanding as well, because we did ask a lot of questions because it was not part of a healthcare component. And the fact is that EMO now has a rehab, which is for the workers in the emergency management office. So what happens is they're called out and they don't necessarily provide medical care to the individuals needing the emergency. The rehab individuals,
Say 240,000 for their rehab bus or something.
they provide care to the actual EMO responders.
Right.
Yes, and then with that, they take healthcare information, which is disseminated electronically to the state. However, there are paper documents they will take in, therefore has them into HIPAA policy as a healthcare component.
It might be the support that
They have to secure.
the actual responders.
Yes.
This vehicle
Yes.
that makes them, yeah, okay. That,
And that's the new part. No, because we asked the same questions, and thank you. Yep. So who's identified in the policy, you'll see as the HIPAA security officer. Well, that's the Cayuga County Chief Information Officer. So all of those individuals are identified in the policy. So the policies that were received for review, they basically outline the county as a hybrid entity. They identify each of the officers. They list the healthcare components. They also provides the requirements for informing individuals of the privacy practices, notice of privacy practices. It also outlines the personal health information uses and disclosures that do not need authorization. It outlines the uses and disclosures requiring authorization. And it also provides an outline of that the uses and disclosures of the PHI requiring an opportunity where an individual can agree or object. It outlines the minimum necessary disclosure, the rights of the individuals, the business associates, and what their procedures will be. It outlines training standards. It outlines the requirements for safeguarding the personal health information, how to handle complaints, disciplinary action, mitigation process, retaliation and waiver, documentation and retention requirements, and of course, the data breach notification and process, which therefore is the policy that we amended to relate to all of this. From once all of these two policies are looked at, coming soon, Rich and I are looking at the Cayuga County Corporate Compliance Plan. That will be coming down the pipe. And therefore, there's the summary on the policy and the amendment to the breach notification. Is there any questions? I know it's a lot, but I tried to summarize all of the information because the policy that is being adopted has several pages. And there's a lot of categories in it, but it is just something setting a standard and something for us to follow in relationship to HIPAA because of our healthcare components.
Yeah, I'll say this at government ops too. I know how much Rich and Sharon and a few others put in. It was an unbelievable amount of time and weeks. And I really want to stick with it and come out with this policy. It's a great policy. So congratulations. Thank you.
Thank you for doing the presentation. It really makes it just so much more understandable what's in front of us.
Yes.
Yeah, if better comes from her than me, I would have just made it so much more complicated.
You would have lawyered it up.
That's right. There's nothing simple I can't complicate.
That's right. All right, any other questions? Right now, motion to adjourn?
But
All right. Thank you, everybody.
it's always Bob and Christina,
I
right?
know, right?
We make a good pair.
Thanks, everyone. Have a good night. Good. I gotta show this to you.
Oh, thank you.